Hello everyone, welcome to Educated Nursing Review classes. I am Akwinder Kaur and today we have a very special session lined up for you. Today we are going to explore the ethical principles in nursing. The principles we are going to discuss are essential not just for your exams like the NCLEX, but they form the foundation of your practice as a nurse. We will cover important principles such as autonomy, beneficence, non-maleficence, justice, fidelity, and veracity. So each of these is crucial in guiding how we as nurses interact with our patients, make critical decisions, and uphold the honor and responsibility of our profession. So without further ado, let's embark on this journey together. Grab your notebooks and be ready to dive deep into the world of nursing ethics. With Educated Nursing Review classes, you are not just learning to pass exams, you are preparing to be the best nurse you can be. So let's get started. Now let's start with autonomy. This ethical principle is about respecting each patient's right to make their own decisions regarding their health and treatment. It's a cornerstone of patient-centered care. And the healthcare setting, this means providing patients with all the necessary information and options and respecting their choices, even if they differ from our own professional opinion. Let's consider this. If a patient decides to refuse a certain medical treatment, as nurses, we must respect this decision, ensuring they are fully informed. This respect for autonomy is vital, even if it challenges our perspective on what might be the best for the patient. Autonomy is closely linked with advanced directives and informed consent. This means ensuring patients understand the potential outcomes of their choices and their decisions are documented and respected, particularly in critical situations. So, as a nurse, it is essential to foster an environment where patients feel comfortable to express their wishes. Ensure clear communication and remember, your role here is to support, not to sway their decisions. Now let's apply our understanding of autonomy with the practical scenario you might encounter in a long-term care setting. This will not only prepare you for the NCLEX but also for real-world nursing situations. So here's the scenario. You are caring for an older client in a long-term care facility. Which action would best encourage autonomy in this client? There are four options. Option 1, planning meals. Option number 2, decorating the room. Option 3, scheduling haircut appointments. And option 4, allowing the client to choose social activities. Now take a moment to think about it, pause your video for a second and try to answer it yourself. Alright, let's continue with the answer and the rationale behind it. So the correct answer is option number 4, allowing the client to choose social activities. Now let's break down why this is the case. As you know, autonomy is about the freedom to make one's own choices, especially in aspects that affect one's daily life, right? So in long-term care facility, when you work in long-term care facility, you will see older clients often face situations where they may feel their independence and decision-making abilities are being diminished. By allowing them to choose their social activities, they feel recognized and respected. So this action gives them a sense of control and personal freedom in their lives. So the other options, while they are caring options, they don't provide the same level of autonomy, like planning meals, decorating the room, or scheduling haircut appointments. They are decisions made by someone else, so potentially limiting the client's ability to make their own choices. When you are preparing for the NCLEX, it is important to understand the questions about autonomy often focus on patients' right to make decisions about their care and daily activities. In real-world nursing, respecting autonomy means actively involving in patient care plans and honoring their choices, either if it's big or small. So it could be simple as letting them choose what they want to wear or what activities to participate in. These actions, while seemingly small, have a significant impact on their well-being and dignity. Now let's explore next principle, beneficence. This principle is all about actively doing good and ensuring the best outcomes for our patients. In nursing, this isn't just a concept, it's a daily practice. Let me explain how. Beneficence goes beyond basic care. It involves understanding and acting on what's best for the patient. This means considering their physical, emotional, and psychological needs. It's not just treating a condition, but nurturing the person as a whole. If you look at the picture, imagine you are caring for a patient who is just undergone surgery. Implementing an effective pain management plan is a classic example of beneficence. You are not just easing their pain, you are promoting their healing and comfort. So, as a nurse, always assess the meaning of the word good for each patient. It could be as simple as a kind word, maybe giving the pain meds or even providing the emotional support. So, tailor your approach to their unique needs. As we discussed, beneficence means nurses want to do good for the patient. They are always thinking about what's best for them. But paternalism is the opposite, and it's wrong. Basically, it happens when nurses make choices for patients without asking them or thinking about them what they want. This is not good because it doesn't let patients decide what's best for themselves. So we should avoid paternalism and let patients have a say in their own healthcare. As we continue our exploration of nursing ethics, let's delve into the principle of fidelity. Fidelity in nursing is about loyalty, faithfulness, and honoring commitments to our patients. It involves creating a trusting relationship through consistent and reliable care and respecting the promises we make to our patients. Fidelity is a cornerstone of nurse-patient relationship. Why? Because it means being dependable, keeping your word, and maintaining confidentiality. It's about advocating our patients' needs and being a consistent presence in their healthcare journey. Let's imagine you have assured a patient that you will follow up on their test results and explain them. So fulfilling this promise is an act of fidelity. It's about being a trustworthy and a reliable figure for your patients, right? In your practice, remember that fidelity is about more than just following the rules. It's about building a trusting relationship with your patients through consistent and reliable actions. So be mindful of the promises you make and always strive to uphold them. Now take a look at this question. As a nurse, which of the following actions demonstrate adherence to the principle of fidelity? Select all that apply. Now this is a SATA question. Let me share some important tips to answer SATA questions on the NCLEX. Number 1. Read the question carefully, not once but twice, just to make sure you understand what is being asked in the question. Second, pay attention to the key points as these will guide your thinking. Remember that each option should be treated as true or false question and must be considered separately. Do not rush. Take your time to analyze each option against the question stand. Third, eliminate any option that is clearly contradictory or doesn't fit in the scenario given in the question. Lastly, be mindful that there could be more than one correct answer, or in some cases all options could be correct, right? So now pause the video for 2 minutes and try to answer it. Alright, let's continue with the answer and the rationale behind it. First up, we got option A, which is correct. This is about keeping health information private, just like you wouldn't want your secrets told to everyone, right? We keep patients' information safe and sound. It's all about respect and following the rules. Now option B is incorrect. This one is about giving meds without doctor's order. That is a big no-no because it could be dangerous and it's not following the safety rules we have got. Then we got option C, which is correct. If you tell a patient you will call them later, you better call them. It shows you are someone they can rely on, right? Option D is incorrect. Letting someone peek at medical records without the right permission is breaking trust. We cannot do that because patients trust us to keep their info under lock and key, right? Moving to option E, which is correct. Being honest with patients isn't just nice, it's necessary. It means they can trust us, and trust is a big deal in healthcare. Option F is incorrect. Imagine you have made plans and someone changed them without telling you. Not cool, right? The same goes for patient care. They should be part of the conversation. Lastly, we got option G, which is correct. This is about speaking up for the patient, what they want, when you are chatting with the rest of the healthcare team. It's about making sure the patient's voice is heard. Okay, moving forward, let's discuss justice. So this principle is about fairness and equity in patient care. It means ensuring that all patients have equal access to treatment and care regardless of their background. Well, justice in healthcare involves treating each patient fairly, allocating resources appropriately, and advocating for equal treatment. It's about recognizing and addressing biases, whether they are personal, social, or systemic, to provide equitable care to everyone. Imagine you are working in a busy unit with a diverse group of patients. Upholding justice means every patient, regardless of their status or background, receives the care they need. It's about being impartial and objective in your care delivery. Okay, take a look at this question regarding justice. As a nurse, which of the following actions reflect the principles of justice? Select all that apply. Now pause your video for 2 minutes and try to answer it yourself. Okay, let's unpack this question about justice in nursing care. Options A, C, E, and G are correct. Providing pain meds based on what patient says. Option A, making sure everyone understanding their care options. Option C, standing up for patients without insurance. Option E, and dividing up work fairly among nurses, which is option G, are all about treating people equally and fairly. It's like making sure everyone gets a fair slice of the pie, no matter who they are. Well, options B, D, and F are incorrect. Now spending more time with famous patients, option B, and giving special treatment to a colleague's family, which is option D, and option F, ignoring cultural needs. These are not fair. They are like giving some people a bigger slice of the pie, just because who they are or what they believe. This is not justice. So, in a nutshell, justice in nursing means treating everyone with the same level of care and respect, regardless of their status, beliefs, or background. It's all about making sure everyone gets the care they need and deserve. As nurses, we have to be the champions of fairness, always. Okay, our next principle is non-maleficence. This principle is defined by the maxim means do no harm. In nursing, it means more than avoiding harm. It's about actively preventing harm and protecting our patients. Let's explore how this principle is applied in our daily practice. Non-maleficence is a fundamental ethical principle in the healthcare system. It involves taking proactive steps to prevent harm to patients, whether it's from medical errors, infections, or even ethical dilemmas. It's about being vigilant and proactive in safeguarding the well-being of those in our care. For instance, in managing immunocompromised patients, strict infection control practices are crucial. This includes everything from hand hygiene to using protective gear. It's not just about following the protocols. It's about understanding their importance in protecting our patients. Okay, now take a look at this question. You are caring for an immunocompromised patient. Select all the actions that reflect the principle of non-maleficence. Option A, regular hand washing and using hand sanitizer. Option B, administering prescribed immunosuppressants accurately. Option C, restricting visitor access to reduce infection risk. Option D, skipping routine vitals to minimize patient disturbance. Option E, using protective gear when providing patient care. Option F, educating the patient about the infection prevention at home. And option G, ignoring minor symptoms to avoid alarming the patient. Now pause the video for a minute and try to answer it yourself. Alright, let's break down this question about non-maleficence to understand why each option is correct or not. And remember, non-maleficence means do no harm. And it's a key principle in nursing, especially when caring for vulnerable patients like those who are immunocompromised. Let's have a look. Option A is correct. Regular hand washing and using hand sanitizer is like nursing 101, right? It's a super important for all patients, but especially for those with weakened immune system. By keeping our hands clean, we are directly preventing the spread of germs. This is a classic example of non-maleficence, like doing our best to not cause any harm. Option B is correct. Giving the right medication correctly is crucial. For immunocompromised patients, getting their meds exactly right can be the difference between getting worse or getting better. Option C. Limiting visitors might sound a bit harsh, but it's all about protecting the patient. More people can mean more germs, which is risky for someone with a weak immune system. By managing who comes in and out, we are reducing that risk, like another way of ensuring we do no harm, right? Now option D, which is incorrect, skipping vital signs. No, right? This is not a good idea. These checks give us crucial information about the patient's condition. Missing them might mean we overlook something important, potentially causing harm. And that's exactly what non-maleficence tells us to avoid. Option E is correct. Using protective gear is not just for our safety but also for our patients. Gowns, masks, gloves, they all help in creating a barrier against germs. For immunocompromised patients, this is super important and aligns perfectly with the principle of non-maleficence. Next one is option F, which is correct. Teaching patients about staying safe from infections at home extends our care beyond the hospital. It empowers them to take care of themselves, reducing the risk of harm even when they are not under our direct care. So it's a proactive approach and totally in line with doing no harm. Last one is option G, which is incorrect. Ignoring symptoms, even small ones, is a big no-no, especially for patients with compromised immune systems. Small issues can escalate quickly. Not addressing them can lead to harm, which goes against our principle of non-maleficence. So, to wrap it up, non-maleficence is all about being super careful to not cause harm, and sometimes it means taking extra steps to ensure our patient safety, right? Whether it's through hygiene, medication management, or education, every action we take should be aimed at protecting our patients, particularly the most vulnerable ones. Keep this principle in mind as you care for your patients. It's a crucial part of being a great nurse. Finally, let's discuss veracity in nursing. Well, this principle is all about truthfulness and honesty in the nursing profession. It forms the backbone of the trust between a nurse and the patient. I'll explain why it's so crucial in our field. Veracity means being truthful in all aspects of patient care and documentation. It involves providing accurate information to patients and colleagues, which is essential for informed decision making and effective care. Honesty builds trust, a fundamental element in the nurse-patient relationship. Here is a typical scenario. If a patient asks about the risk of a procedure, it's our duty to provide complete and honest information. Likewise, if a medication error occurs, reporting it accurately is vital, not just for the patient safety, but also for maintaining professional integrity. In conclusion, veracity is not just a moral obligation, but a professional one. Upholding truthfulness in all aspects of care is key to maintain trust and credibility in the nursing profession. Okay, this final question is designed to bring together everything we have discussed about beneficence, autonomy, veracity, non-maleficence, justice, and fidelity. It is a comprehensive scenario, one that you might encounter in your nursing career. It's crucial not just for those who are preparing for the NCLEX, but for anyone committed to ethical nursing practice. Now take a look at this final question representing the next gen of NCLEX question. Okay, scenario is a nurse is working in a busy hospital unit. Throughout the shift, the nurse encounters various situations that require ethical decision making. The nurse strives to uphold the ethical principles of beneficence, autonomy, veracity, non-maleficence, justice, and fidelity. Now, question here is, In which of the following situations does the nurse demonstrate adherence to the ethical principles of beneficence, autonomy, veracity, non-maleficence, justice, and fidelity? Select all that apply. So pause the video for a few minutes and try to answer it yourself. Let's look at how these situations reflect our ethical duties in nursing. It's not just about doing our jobs, it's about doing them in a way that respects our patients and upholds our professional standards. So correct options are option number 1, 3, 4, 6, and 7. So option number 1, when we let patients make their own choices about treatments and we are respecting their rights, this reflects the principle autonomy. Option number 3, treating everyone fairly no matter who they are. This is all about justice. Option number 4, giving patients the full scoop on their health is being honest. That is veracity. Option number 6, reporting mistakes helps keep everyone safe, which is part of non-maleficence, and it's being true to our professional duties, which is fidelity. Option number 7, keeping private stuff private, is also fidelity. It's about maintaining trust. Next incorrect options are option number 2 and option number 5. Giving more meds than prescribed, which is option 2, could harm the patient, which breaks our rule of doing no harm, non-maleficence. And deciding for a patient who can decide for themselves, which is option number 5, takes away their right to choose, that is their autonomy. So remember, every action we take as nurses should reflect these ethical principles. It's not just about what we do, but how we do it, with respect, fairness, and honesty, and a commitment to doing no harm and maintaining trust. That's what ethical nursing is all about. Thank you so much for joining me in this deep dive into the ethical principles of nursing today. If you found this video helpful, please show your support by giving it a thumbs up. And if you haven't already, don't forget to subscribe to our channel and hit the bell icon. This way you will be notified every time we post a new video. Also, follow us on our Instagram and Facebook page for more updates and insight into the world of nursing. If you got any question, any concerns about anything we discussed today, or is there a specific topic you would like us to cover in future videos, please drop a comment below. Remember, nursing is not just a profession, it's a commitment to ethical care and lifelong learning. We are here to support you on this journey, so stay curious, stay informed, and keep making a difference. Until next time, keep learning and growing. Bye for now.